Certified by the American Board of Plastic Surgery is an important one. It involves a significant amount of training and an exam process at the end, which certifies you as a plastic surgeon. I did my residency at the Leahy Clinic in Boston, and it was a bit of a different plastic surgery residency in that my residency director was a cosmetic surgeon primarily, and so I learned a lot of nice cosmetic surgical techniques during that residency. I'm a member of the American Society of Aesthetic Plastic Surgery, which is a group of surgeons who really specialize in cosmetic surgery. My office is at Swedish Medical Center, where I'm chief of plastic surgery and have been for many years. I've been working for 20 years. My practice is basically limited to aesthetic surgery. In the last 16, 17 years, primarily aesthetic surgery, and I've done thousands of aesthetic surgery procedures here in my office suite. My office suite is accredited nationally. This group, quadruple ASF we call it, accredits probably many thousands of, maybe 1,000, over 1,000 operative suites across the country. I don't think we can minimize the effect of my staff. We've got a hand-picked group who I think are sensitive to the needs and requirements of transgender patients. For the last 12 years or so, I have been seeing more and more transgender patients for both feminization and masculinization procedures, and now it's a significant portion of my practice. We use a wide array of procedures to feminize the face, and of course you want to maintain harmony. I tend to see patients who require some degree of rejuvenation as well as feminization. The keys to success in feminization surgery, of course, experience and training are important. You want to go to someone who's well trained and has good experience in feminization techniques. But even if they know how to do the surgery, if they don't have a keen understanding of the differences of the male and female facial structure, you may not get where you want to be. I think there are some very definite signs or different structures in the face which tend to be more feminine or more female appearing. Certainly the brow area is an important one. Lip features, nasal balance, a more dainty, refined nose. Chin and jaw contours. I think especially towards the front, a wide chin is fairly masculine. I think the question comes up about whether a wide jaw towards the back is feminine or not, but we frequently recontour that area as well. And also the Adam's apple, we do reduce that because it tends to be more prominent in men for sure. I also have a large experience in breast augmentation and breast contouring procedures as well as body contouring procedures, both involving lifting and tightening as well as liposuctioning and repositioning of fat to help achieve feminine contours in the body. So we talked about anatomy, and if you look at this gentleman, obviously this is kind of the extreme of a masculine face with a wide prominent nose and a wide chin, a little wide to the base of the jaw, and a significant amount of bossing across the brow and a straight brow rather than arched. His hairline is not really high or low. And as we're working on the brow area, it's important to think about getting a nice improvement, but also avoiding danger. We recontour the front of the bony sinus as we do brow contouring, and then we leave the sinus alone. There is a procedure where you can break the anterior border of the sinus and move it back, but you're not very far from the brain doing that, and I think that's probably a little excessive for a cosmetic procedure. Maintaining function when you do operate with the larynx as you're trimming the laryngeal cartilage. Just inside the front of the laryngeal cartilage are your vocal cords, and they're important for talking, so we can be somewhat aggressive doing that, but you have to be careful you maintain function of those vocal cords. I suppose you could divide it up into the upper face, the mid face, and the lower face if you're thinking about various procedures that we do with feminization. The mid face is cheek implants, lip balance and contours, frequently rejuvenative procedures, cheek lifts, fat grafting, and the brow we talked a little bit about, hairline, brow, and position of the brow as well as prominence of the bone. And frequently we do some eyelid operations on people, blepharoplasties they're called, and some recontouring of the lower face is an important part of it as well. This patient demonstrates the kind of thing you see with brow recontouring. Now, she does have significant laxity of tissues, more than your average person, but elevating the brow into a more natural, not a more natural, but a more feminine position, and recontouring the bony brow gives a much more feminine look to the eyes. And she had some aesthetic surgery on her eyes, taking care of some lines and wrinkles, but just repositioning that brow is a very powerful way of feminizing the face. And frequently we look at three things when we do the brow. We look at the location of the eyebrow, and so elevation and arching. We reduce bony prominence and lower the hairline in a lot of patients all at the same time. The perioral area, the lips and the area around there, nice areas to give both rejuvenation and feminization. You can shorten the lip, so there's an incision up underneath the nose where we elevate the lip and shorten it, and plump them and fill them out, and there's various ways we do that with lip implants or fillers or even fat grafting. Here's a patient. It's not my patient, but it's a picture of a patient who's had some silicone lip augmentation, and just, pretty typically a little rounder and fuller. No lip shortening or anything. The filtral columns are fine, but just a little rounder and fuller to give a more feminine appearance. People's bony structures sometimes are lacking, and this patient had both cheek implants and a chin implant, just to refine and define the appearance of the jaw and also the cheek area, and it was combined with a facelift to tighten up loose skin over the area. Tracheal shave to reduce prominence in the area. This patient has a fairly skeletonized neck, as we say, not a lot of soft tissues to help cover that, so it's a nice improvement. That's about all you're going to get, though, if you want to maintain function. Generally, patients are pretty pleased with the reduction in that area. A lot of patients, we address them and approach them as a total feminization at the same time, same operation. Sometimes we stage them, and a lot of time we do it together. It depends on what the patients want, and sometimes on finances, and also what's safe. But she's had a pretty extensive facial rejuvenation with brow elevation and cheek implants, chin implant, some rejuvenation with facelifting, and just kind of recontouring the area and recontouring the larynx, and I think she looks more feminine. Other patients that have had eyelid tucks, which commonly we do along, she's got some bulging of the lower eyelid and a little excess skin on the upper eyelids. We just want to brighten them, make them look a little more youthful and relaxed. A gentle brow elevation to give more of an arch, releasing the muscles that cause these frown lines, and a little eyelid tuck to make sure it look more rested and youthful. And then once again, a subtle brow lift, elevation laterally, just to lift up over the edge, and eyelid reduction and taking away excess skin just to brighten the eyes and make them look a little more feminine, a little more youthful. The nose is in the middle of your face, as you know, and so rejuvenation in this area can be quite dramatic. Most time, more feminine noses have a little less prominence over the dorsum, as we call it, the top of the nose, so we tend to narrow that and take it down. How far we go down is discussed with some digital imaging prior to the procedure. We generally want a little more dainty look. We narrow the tip, elevate the tip sometimes. You want the tip to angle up as compared to down. You don't want a hanging tip. Those are the kind of things we try to achieve with nose surgeries, and you can see that this patient has a crooked nose and wide and prominent. And so a little elevation of the tip, taking the dorsum down, just makes it look more feminine, a little more dainty. And she went on later to have, you'll see in a minute, more elevation of her brow and more rejuvenation up high. But a nice kind of refinement of her nose. So you can see it well down the road. And also she's had elevation of her brow, recontouring that area. Mostly nose and brow area in this patient. Maybe a little narrowing along the chin here, but definitely a change from masculine to feminine. So what do you want from surgery? Well, you want to look as feminine as possible. And when you take into account hair and clothing and facial rejuvenation, I think it's quite convincing. That's why it's called facial feminization surgery. What you don't want are visible scars. This patient had a facelift. The incision runs along the hair, around inside the ear, and around the bottom and back up there. With meticulous surgical technique, we can hide them in proper skin folds, and if you have a good understanding about the way the skin's supposed to drape over various areas, you can hide incisions in certain areas, and just with meticulous suturing make them look as minimally noticeable as possible. Incisions run down around here and up and around in the back. Along the hairline is an area frequently you'll see this centrally here. You want the hair to come back out through the scar to help hide it. Once again, an incision along the front, if it's properly done. You can see it when you look close, but it should be minimally visible. Incisions for lip lifts are hidden along the nasal crease here, runs out up along the bottom. Breast augmentation obviously is an important part of feminization surgery. I've done thousands of breast augmentations. Probably the most important part of a breast augmentation is what takes prior to the operation. We talk about incisions, and usually I go underneath in the fold. We talk about the plane. I pretty well always place the implant beneath the muscle as well as the breast tissue. because it helps camouflage the implant. They look and feel more natural. They tend to last better. Implant shape is important to make sure it's not too wide, but the most important decision you make is the size. Most transgender patients have a silicone implant because most of them don't have a lot of natural breast volume, and so the downside of sailing with possible visible rippling and firmness is more evident, and the silicone is a better choice. So you want roundness and fullness. Size is decided by the patient. The incision runs along a little on the bottom. But you want to generally most patients want somebody who kind of balances their body and looks better. Patients sometimes have like caved-in chest appearance, not a lot of natural fullness, and so this is a little bigger, a little rounder, but that's the goal of some patients. Actually, kind of a difficult case. You can see the folds are not well formed at all, but with good technique and with the moderate size implant, looks nice. A lot of patients who want bod or contouring want a more natural, femininely natural shape. So sometimes you want to kind of narrow the waist a little bit, maybe add a little in the hips, take a little bit out, add a little in the buttocks. So above is the pre-op and down below is a more natural hourglass kind of shape around the buttocks as compared to kind of a lumpy look. Liposuction thighs, narrowing them, liposuction around the waist, around the hips, all these kind of things are procedures that we do for body contouring. And occasionally patients, now most of these patients will be patients who've lost weight. We do abdominoplasties where we take away excess skin and fat to give it more natural, more feminine shape, more fullness in the hips and narrow to the waist. So you can do pretty dramatic procedures in patients who need them. And of course we do patients who are female to male transgender. Most commonly the patients who see are having breast surgery, but occasionally we can masculinize the appearance of the face by broadening the jaw, broadening the cheekbone, maybe working on the nose. Fat grafting can be quite useful for filling out certain areas to give areas of fullness. And I try to use minimal scarring techniques for breast tissue removal while maintaining the location and appearance of the nipple. Most patients I do have a nipple grafting technique which minimizes scars and gets rid of the thickness of the nipple as well. So if you're interested, give us a call. I'm at Swedish Hospital. This is my office, although we're getting a new office, which is going to be nice as well. We have my own operating suite, which is private, which is nice. It's nationally accredited. It's very safe. We have a typical recovery room with all the equipment that you need. We can always arrange for any ride you might need, any post-op care you may need. We have people who specialize in taking care of post-operative patients. I frequently admit patients to Swedish Medical Center after surgery as well. They do a great job taking care of patients. And we have interest-free financing at times, and we have competitive pricing, I hope. We can definitely deal with you over the phone some. I definitely feel that a face-to-face consultation is better than anything you can do over the internet, especially from a communication point of view. And that's all. Thank you.